We see a few new studies too coming out saying that people took the COVID vaccine, but their confidence went down. And that they took it because they felt like they had to take it. They were forced to take it, but they resented it, and they didn't want to go back to get another vaccine of any sort.
Hello, my name is Andrew Pollard. I'm Director of the Oxford Vaccine Group at the University of Oxford. Welcome to our podcast series, The Oxford Colloquy, Trust in Science, bringing you the stories, facts and people behind the science. In this episode, I'll be speaking with Professor Heidi Larson, the founding director of the Vaccine Confidence Project at the London School for Hygiene and Tropical Medicine. And her work over many years has been in trying to understand confidence in vaccines and trust in science all over the world. Heidi Larson, founding director of the Vaccine Confidence Project at the London School for Hygiene and Tropical Medicine. Welcome to our podcast.
Nice to be here.
So Heidi, you're an American anthropologist. Why did anthropology take your fancy?
So my undergraduate thesis was an ethnographic study of 5 Down syndrome children that had been moved from a special institution into a public school. You know, a lot of what I was learning about how kids through their play behavior can negotiate differences. And so I thought this would be an interesting way to look at differences around the world. And I ended up getting a year-long Sheldon Fellowship, and I was going to be in a few different places. I ended up spending the whole year in Israel because I was so fascinated by its microcosm.
Well, that was in the West Bank, was it?
West Bank, Gaza, and then also I was looking at different situations. So I started working with Save the Children in West Bank and Gaza. And when that particular project we were working on ended, they said, listen, we're about to start a program in Nepal. Would you be willing to come? And I was saying, well, I wanted to head that direction anyway. So it was fantastic. And that's how I first got to Nepal. And then when that 6-month wrapped up, I went to UNICEF because I had fallen in love with Nepal. And it was really my 3 Nepal years that I really found myself turning more and more to anthropologists, because I saw a number of development projects it's kind of overused word to be parachuted in, but without really thinking about the context they're landing on. So it was really there that I decided to go back and do my PhD in anthropology, which ended up being in the UK, in Southall. That was my field site. But there I was looking more at the role of children, how children helped their parents navigate the health system because they had the language, and they were exposed to and learned a lot more about health conditions, particularly young girls hearing about all kinds of interesting, gynecological issues with their mothers they had to translate from like 7 years old. And then I didn't expect this, but one of my examiners at my PhD exams, he came up to me after and said, listen, I was just appointed to be head of Apple Education, and I think I need your help, because they told me the biggest thing I'll face is resistance from the teachers to have 1 computer per classroom. So I've been looking at this issue of resistance to new innovations and interventions for a while, but from different perspectives, but then ended up going back to UNICEF after that.
And so how did you go from that sort of training in anthropology in your PhD to being interested in vaccination and the barriers to vaccination?
It was when I was asked to come back to UNICEF headquarters in New York in 2002. So it was during those 5 years, 2000 to 2005, that I just saw this growing number of questions and issues and even refusals of vaccines. And the more I would have consultations with countries, they had heard little whispers of something or knew very well that there were issues, but didn't think it would become anything. The most incredible rumor that, in terms of its impact, that I saw was in Kano State, where there was not even an adverse event or even a suspicion of an adverse event. It was really politically driven, but rumors about the vaccine sterilizing populations. But that rumor and the governor putting a shutdown, a boycott of the vaccine, led to polio spreading back into, I think it was over 20 countries that had already been declared polio free, and cost the polio program, I think it was close to $500 million just to recover that. And that was really, I said, wow, if just a rumor in a remote state in a northern country can have this kind of global impact, this really deserves further investigation. But when I started to work on that, it was very clear that this was not just a polio issue, and all vaccines were vulnerable to this.
So, have you got sort of an idea of what confidence looked like then? So this would have been in the late 2000s, I think, and what it looks like now. Have things got better or worse?
Well, the biggest question that people kept asking me when I was trying to get attention to this was, how big is it? Has it gotten worse? And that's where I said, we don't know. I said, and, we've never heard this level before of questioning or refusals, but that's anecdotal. So I left to set up the Vaccine Competence Project really to measure and monitor it and get a baseline. It has gotten a lot worse, but we also we have a lot more vaccines than we've ever had.
So, I mean, these aren't what we're talking about here, nice to have vaccines. These are life-saving vaccines that stop children dying. And when you did your initial survey, you found many countries had quite low levels of confidence. And in those initial studies, where did you see the worst cases were?
Well, I was surprised to see Europe as being the most skeptical. I had thought it would be the US, but I think if you disaggregate the states in the US, it would look a little more like Europe, with some being, less skeptical than others. France won the prize.
In that first survey, yes.
Yes, for the 2015 global baseline, we did 67 countries, and France was, to put a number on it, 42% of the nationally representative samples said that the statement "vaccines are safe" was not. They did not agree with that, and that was, I think, the average in the rest of the world was about 13% said they did not agree.
Do you have a sense of what the drivers are for those differences? Are they to do with the relationship between the public and the state? Is it some scares that have happened in those countries in the past? And also, you and I know there have been unfounded scares in France around one of the hepatitis vaccines some time ago. But can you track the reasons why there are differences by country, even countries next to each other?
Yeah, that's always fascinated me, how they can have issues with different vaccines. In France, as you said, one of the issues was the scare about the hepatitis B vaccine, suggesting that it could cause multiple sclerosis, which it has been researched and debunked a number of times. But the thing that really, as they said, put the nail in the coffin was that even against the advice of WHO and other advisory committees to tell the minister that it was not advisable to shut down the school hepatitis B program because there was no clear evidence to justify it. He went ahead and did it anyway. And the fact that it was suspended really just made everyone feel like, aha, there was a problem. We thought so. But then there were even previous things like the tainted blood scandal, HIV, They found HIV in the blood, some of the blood supply. I mean, they were trying to deal with it as soon as they found out, but they didn't tell the public about it soon enough. So the things that breed distrust in government that can have a knock-on effect on vaccines don't even have to be about vaccines. They're things that just break trust with government. And I mean, even in the UK, before the Andrew Wakefield publication that suggested wrongly that the MMR vaccine could link to autism, there was the, as they were calling it then, the mad cow disease anxieties. And so you already had a public that when there were efforts to say, this is incorrect information about the MMR vaccine, some of the public was saying, why should we believe you? You told us there was no problem with this previous episode. So it doesn't even have to be a specific vaccine issue. It can be another health issue. So trust in governments.
Yeah, and the mad cow disease, it's a prion disease, a disease affecting the brain that was acquired from some contaminated meat, with very small numbers actually affected in the UK. But at the time, it was not clear how big a problem it was going to be. But the handling of it was perhaps drove some further mistrust. And of course, most of these concerns have been disproven. In fact, all of them that we mentioned have been disproven, and they didn't have any scientific basis. So where does this thinking come from? If we think perhaps from your perspective as an anthropologist, why do we latch on to these ideas which are not true?
Well, I think that we don't really have a clear answer to their question. And in the case of autism and MMR, there was a public ripe with questions of why does it look like so many more kids are getting autism? And the fact that some of the early symptoms and signals of autism happens at a time when you get one of your MMR vaccines. So that coincidental connection started to get into people's minds. And then, when that paper came out suggesting that link, there's an answer. It makes sense. It's plausible. And nobody is giving me a better answer. And I know when CDC in Atlanta was asking me, what can we do? I said, well, find them a better answer for why children are getting autism. And once, I think, it's a bit late now. I mean, we did a mapping of the global spread of perceptions about MMR, and it was everywhere.
I guess one of the problems is that you can come up with a false idea about vaccines and vaccine safety without requiring any proof. But from a scientist's perspective, if someone challenges you don't want to just answer, no, it's not true. You want to generate the evidence to show it's not true, which can take months or years and costs a lot of money. And it's very difficult always to prove an absolute truth over some of these things, which are usually trying to prove a negative. Do you think we've got it wrong from a science perspective of fighting by trying to generate this huge body of evidence, which is to prove a negative, when absolutely there wasn't any evidence in the first place and we should have just been more robust?
It's a challenge. But I think that there's been enough studies that have showed that being transparent does not discourage people. In fact, it gives credibility. But there was one really, I thought it was a good study in the US on adverse events following immunization reporting. It's already unfortunate naming to say adverse events when it's really reporting things that are not yet confirmed. But at any rate, the study was looking at people when they were given the usual flyer in the clinic that gives you the real basic, mostly benefits about the vaccine your child is about to get, to something that has a little more than that gives you the rare risks, but not too much, and then given much more detailed stuff. And when they had a little bit more, they trusted it more. When you gave them too much, that was too much, you know. So what that study showed that a little more is good, but there is too much sometimes. And I think scientists want to give more detail than they need to, and there's no simple answer to it. But the problem is that when people already have in their mind that they don't want something that, you know, almost nothing you can say is going to change their mind. But there are a lot more people in this middle ground. And I think where we did go wrong is a decade ago and more, that when the people that were still open but having questions, we were dismissing them, or you know, they felt like they weren't, there was no space for them to ask questions, and that hardened them. And that's, I think that there's been quite a change in the landscape now. I think there's a lot more attention to listening and understanding, but it's taken a lot of work to get to where we are now.
And then we've just been through the 2020 coronavirus pandemic and global use of vaccines for that. Do your latest data suggest that things are getting better or getting worse?
In terms of confidence in vaccines, childhood vaccines, which is not about the COVID, but the COVID vaccine and pandemic experience has definitely knocked confidence in childhood vaccines down. In 55 countries, this is published in the UNICEF State of the World Children's Report from 2023. And also it's coming out in a paper, but out of the 55 countries that we had enough pre-pandemic vaccine confidence data with our confidence index, and then run again in 2022, and we ran it again in 2023, 53 of them had not an insignificant drop. South Korea had the biggest drop. And I've just reviewed 2 other papers from totally different researchers that are seeing the same issues. I think it's important that we monitor this, because some of it still might be the kickback sentiments, the hangover, negative, frustrated sentiments. But I don't think we absolutely cannot think that we're going to bounce back. We have very different publics now. And also we see a few new studies too coming out saying that people took the COVID vaccine, but their confidence went down. And that they took it because they felt like they had to take it. They were forced to take it. They took it because they wanted to go to the restaurant or to see their friends or to go to church or somewhere that needed it, but they resented it, and they didn't want to go back to get another vaccine of any sort.
So the confidence in vaccines has fallen based on the survey work that you've been doing. Does that translate into a fall in coverage of childhood vaccines? I mean, we have seen a global decline in coverage, but there are many reasons for that. But do you think there's a direct link between confidence and uptake?
Well, there is a link, but it's not immediate. And that's one of the reasons I picked confidence for our metric, because what I saw in my years in UNICEF when I was out there investigating all these other situations, that there were early signals and people just weren't dealing with it then. And they only, started to panic when they saw the vaccine rates go down. So I picked drops in confidence as a predictor. Not that it necessarily means that, but it's a good signal that even if it doesn't immediately affect uptake, you don't want your confidence to drop. Usually there's a lag time. With the Andrew Wakefield paper in 1998, it took 5 years for the lowest, for the biggest drop in uptake in the UK, and that's in the UK. So just as a guesstimate, it can happen quickly, but it's usually a slow burn kind of thing. So you do have time. So I think that we need to use that time.
So all of our surveys in the UK, and it's true in many other countries, that look at what could you fix in immunisation delivery. This is delivery of life-saving vaccines for children. It shows that it's much more about access is the biggest problem, whether you're in our health system here in a high-income country or in low-income settings. It's just making the vaccines more available and probably the health professional more available to answer some of the questions that parents have as well. So is there an element here where the focus on confidence could be a distraction from where we actually need investment, which is just better systems for access?
Absolutely not. We absolutely have access issues, but we've always had access issues. In fact, we've always been focused on access issues. This is something above and beyond access issues. We can't drop the ball at all on access. It needs the same attention and probably more, but we have an additional layer of issues related to confidence that we didn't have before. And it's not an either or thing, because part of the issues with access are eroding confidence. But sometimes it's been eroded for so long that even fixing the system is not going to build back the confidence.
And so if we look at this difficulty that there is with confidence and that falling, and as you say, the risk that makes it much harder to get good coverage of vaccines in the future, what strategies do we have to improve confidence? I think if we look at some of the other big public health interventions that have happened, like seatbelts and smoking bans, they have transformed health as a result of their implementation. Should we be mandating vaccines? Because that then perhaps reaches the same position as we are with seatbelts, where if someone gets in your car and doesn't plug in their seatbelt, you probably wouldn't drive off, or even if you did, the car would tell you that the seatbelt wasn't in. So do we need to get to the point where the public all look to each other and say you should be getting your child vaccinated?
I appreciate the parallel to seatbelts and helmets and things, but they don't have risks. They're not like an intervention that physically, it's quite a different thing in a sense. I think a certain level of rigor is needed to incentivize. And I am a strong believer in, like workers in hospitals getting vaccinated and certain situations. I think for school kids, the US has been through a lot with that. I do think there should always be an opt-out. And we know that, in the UK with the smallpox, the first anti-vaccine league was actually the anti-compulsory vaccine league. And that was all triggered by the mandate. And the thing that kind of calmed the masses was when they gave the conscientious objector clause, which I always thought was about the Vietnam War, but I later learned that's much older. And I think people want choice.
So how do you feel about the future, having been in this business now for quite some time? Are you optimistic about the future?
Well, I'm certainly optimistic about a lot of the young researchers that I've met, and I'm optimistic about the potential for innovation. I think we have a lot of new technologies that are an opportunity. I think we have to be careful with some of them and take it, and also make sure we don't divide the world even more with the haves and the have-nots. But I am positive. I think it's a challenging time. But as I've said to Bill Gates, Mr. Gates, you are an impatient optimist, and I'm a patient optimist.
Heidi Larson, patient optimist and director of the Vaccine Competence Project. Thank you very much for joining us on this podcast.
Thank you.
That was the Oxford Colloquy Trust in Science, bringing you the stories, people and facts behind the science. So you might be wondering, what is a colloquy? A colloquy is a discourse or conversation, and I hope you'll agree that that's what we've been having.